Mucopolysaccharidoses, or MPS, is a family of genetic conditions that affects how the body grows, including the skeleton. Although there is no cure for MPS, we can treat many of its effects. In this video, we will review 5 common ways that MPS affects the skeleton and how surgery may help in some cases. Thoracolumbar kyphosis. Thoracolumbar kyphosis is the most common spinal deformity in MPS and looks like a hump in the back, sometimes called a gibbous deformity. This is caused by an outward curvature of the spine due to one or more of the bones in the back, called vertebrae, being wedge-shaped, usually in the area between the thoracic and lumbar spine. Kyphosis can be corrected through a spinal osteotomy, where the back parts of the spine are removed and the spine is placed into a more correct angle. It is secured in place with screws and rods. Next, new pieces of bone, called bone graft, are placed over the hardware. This is called a fusion, which makes the area stable. A fusion reduces some of the spine's flexibility, but the areas that were not fused will still be able to move. Cervical stenosis. The vertebrae of the back make a long tunnel that protects our spinal cord. Cervical stenosis is when the spinal cord becomes pinched within the canal. In MPS, this can happen in 3 ways. First, the bones of the spinal canal can be too narrow. Second, the joint can be unstable, pinching the spinal cord between 2 misaligned rings of bone. And third, the outer protective layer of the spinal cord, called the dura, can be too thick. Any combination of these factors can pinch the spinal cord. This can cause weakness, clumsiness, unsteady walking, bowel and bladder issues, neck pain, and headaches. Cervical stenosis can be corrected through a surgery called a decompression and fusion, where the back part, or lamina, of the first vertebrae is removed. This is called a laminectomy, which decompresses or relieves pressure on the nerves. Next, hardware is placed, and it is fused with a bone graft. This makes the joint solid and stable while still allowing the neck to move. Hip dysplasia. Hip dysplasia is when the hip joint, a ball and socket joint, isn't as round as it should be. The hip bone, called the pelvis, may be flattened. The thigh bone, or femur, may be flattened. And sometimes both may be affected. This can cause joint pain and may lead to the hip becoming partially or completely dislocated. Hip dysplasia and MPS can be corrected by a hip osteotomy. First, a wedge of bone is cut from the neck of the femur to lower the head of the femur into the joint, and hardware is added. Next, the socket of the hip is cut, and it is moved back on top of the femur. Finally, the wedge from the femur is resculpted into the open space left by the rotated socket. Over time, the gaps fill in with bone as they heal. Valgum. Valgum, or knock knees, is when the knees are too close together. This can cause problems with walking and balance. Valgum can be corrected by guided growth surgery, where small metal plates, about the size of a paperclip, are placed to lock one side of the growth plate, allowing the other side to grow freely. This evens out the angle of the knees over time, drawing them apart. Carpal tunnel syndrome. Carpal tunnel syndrome is when the thicker connective tissue in the wrist, including the transverse carpal ligament, puts pressure on the median nerve. The median nerve controls about half the nerves of the palm-facing side of the hand, as well as the muscles of the thumb. As the median nerve gets squeezed, it doesn't work as well as it should. The skin may start to tingle or go numb, and the thumb may start to become weak. Your child may become clumsy, pull their hands back from being touched, shake or gnaw on their hands, and have difficulty holding objects. However, it is not common for carpal tunnel syndrome to cause pain. Carpal tunnel surgery. Surgery for carpal tunnel involves cutting the transverse carpal ligament, which relieves pressure on the median nerve. Next, the area around the nerve is cleaned up from any foamy gag tissue that is built up over time. At Children's Hospital Colorado, we are ready to help you and your child on their journey with MPS, from before birth into adulthood. We will work with you and your care team to determine if surgery is necessary and do our best to improve your child's quality of life. Our nationally recognized experts are frontrunners in the latest advancements in research and care, and work with our Inherited Metabolic Diseases Department so you don't have to travel to see different specialists. We are proud to be associated with the MPS Society, a nonprofit that serves individuals, families, and friends affected by MPS, increasing public awareness and supporting research to work towards a cure. To learn more, call us at this number, click the links here, or visit our website by clicking the links in the description below. You can also watch our video on MPS by clicking here.